I'd like to acknowledge the traditional custodians on the lands where we're creating this video and where you may be watching this video. I'd like to pay my respects to elders past, present and emerging, and extend that respect to all First Nations people. I'd like to introduce Darren Burns, one of the 5 hospital liaison officers who rotate through East Grampians Health Service. Hi Darren, can you please tell us a little bit about yourself and your colleagues and about the role Aboriginal hospital liaison officers have here at East Grampians Health Service?
Thank you, Mario. There's 5 of us in the Aboriginal health team. We've all come from wide different backgrounds. Emma's been in the Aboriginal liaison team for the last 6-7 years now. Renee's come from literature and with women and children, so she's come across with a wide experience now in health. Kevin's been a orderly at the hospital in radiology for the last 7 to 8 years. I've got a 7.5 year history in the hospital with security, and we've got a young girl, Michaela, who's just starting out in the hospital. She's been with us the last 5 months. Our role mainly is to support the Indigenous families and the community, patients. We're a link between the medical team, patients, families, and driving during their admission. We attend appointments and advocate for patients, ensuring they understand the information, procedures, medication, medical procedures and admissions, because a lot of our clients sort of don't. Even if they are getting told something by a doctor, instead of acknowledging that they don't understand, they'll just nod because they don't want to, through previous history, someone look dumb because they've been told that a lot of their life, so they sort of just acknowledge that they understand. And when you sit down with them afterwards and have a chat to them, they basically say they don't want to go to the head procedure as if agreed to with the doctor because they didn't understand it. We provide face-to-face contact, social, emotional and cultural supports, engagement of advocacy for patients and their families, assist with discharge planning and accessing resources, assist with queries for patients and families, follow-up care with patients, contact patients who have missed appointments to find out why they missed it. They maybe simply forgot or whatever, and we'll see if they need to rebook their appointments if required. And we also, as much as we're there for the patient, we're also there for the hospital. We'll enforce that the patients understand their hospital procedures and policies and they abide by them too. So we will go and have to talk to the patients if they are misbehaving or not doing the right thing by the hospital.
I think that's a great background into the role, and hopefully it'll give everybody a bit more of an idea of what the role entails. So you've been with us now for a little time, probably earlier this year.
Mid-July.
Mid-July is the team started, yep. So can you tell us a little bit about what you've been able to achieve since mid-July for East Grampians Health?
It's been a long process. We're now receiving emails in regards to patients with hospital to assist us with contacting patients for appointments, for arrivals and that. So we're getting a weekly emails with upcoming appointments for patients, so we can make the phone call, liaise with them and see if they want us to be involved while their presentation. We're researching companies to assist us to provide the acknowledgement plaques that incorporate the artworks by the competition winner Talitha Podger, and we're also looking to incorporate some of the artwork into a shirt for East Grampians Health. So it will be an individual shirt for East Grampians Health instead of wearing the same one we do at Grampians Health in Ballarat. We're working closely with Stuart Kerr and the team to provide a small garden space out the back of the diaries area down there, and also with Wendy over at Low Street for another little Indigenous garden over there. We're providing culturally based activities once a month down with the Patricia Hentry Group. Continuing to develop and work in relationship with Budgie Budgie to ensure continuous service of First Nations patients, requesting appointments to be booked on a Wednesday and Thursday where possible, so the AHLO team can catch up with patients when they come into hospital, because we're only in Ararat on Wednesdays and Thursdays each week. And we now have access to the East Grampians internet to download stats and information regarding patient contacts and supports.
Thanks, Darren. I think we can agree that it's taken a little bit of time to get some of these things going, but And we've already had some successes with some of our patients and our staff contacting the team. So there's some recognition there now that it's an important part of our service offerings, which is great. So here since July, and we're heading into the new year. What are you excited about, and what do you think you're looking forward to as the team progresses into 2023?
Continue the growth of the relationship between East Grampians Health and the Indigenous community. Continue to build strong relationships with community, because we're from Ballarat, so it's also new for us. A lot of community members up here. It's like another family altogether. Like in Ballarat, most of us grew up in Ballarat, so we know most of our clientele coming in. Up here, it's a different. So we're in the same boat as yous are, sort of, so to speak, because clients take a lot to sort of trust, so to speak, because of tradition, past histories and stuff, especially with institutions. So yeah, hopefully continue to break down that barriers too, because like as I said, with past experience with institutions, Aboriginal people haven't got a real good history of attending appointments at doctors or anywhere else. So hopefully with us involved and being able to communicate with the community, we can get patients coming in and seeing their doctors earlier than they usually do, and getting earlier diagnosis, better outcomes, a healthier community, and maybe longer life expectancy moving forward.
All right. So thanks for that, Darren, and no doubt we'll continue. And I'm really excited about the garden that we're going to create down there too, as a safe space and quiet space for Indigenous people as well. So that'd be great.
Yeah, I think it'd be somewhere that people and family can go and reflect when in the time of need, with certain diagnoses or different after they've been given or told, and sometimes you just need that time out in their own space to reflect. So it'd be great to have somewhere that they can go and feel comfortable.
All right, thanks for your time, Darren, and thanks for watching.
No, thank you, Mario.